Good afternoon, everybody. We are now starting the webinar. So I welcome all of you. I understand we have people from different countries, Maldives, Bahrain, Sri Lanka, several other countries. So welcome to this webinar. Today's webinar, for those of you who have not heard me before, will be life-altering. You're going to hear things in this webinar that you did not know were possible. And it is going to bring new hope, new light for our special needs children. So the topic is, what are the recent advances in the treatment of autism and cerebral palsy? I am Dr. Alok Sharma. I'm a neurosurgeon, director of the NeuroGen Brain and Spine Institute, and a professor and head of department at the LTMG Hospital Medical College. So we are all here because we all have special needs children. They are children with autism, cerebral palsy, intellectual disability. And we've gone from pillar to post, we've gone to different doctors and have been told just one thing, that nothing can be done for your children. The only option available is to do rehabilitation. There's no drug, there's no medical cure, there's no surgery. And I'm here to tell you that that is no longer true. And we'll see how that is. So there are now a combination of 3 treatments available, which together can reverse autism, which together can give independent living to our children with cerebral palsy. Yes, you heard me right. It can actually reverse these conditions. And this combination uses cell therapy, rehab, and new therapies called integrative therapies. So this is on the left side is a picture of a fracture of the leg. You can see the bone is broken. And I ask you a question. Will we do rehabilitation? Suppose our leg is fractured. Will we do physiotherapy on a broken bone? We will not, right? You will get it fixed by an orthopedic surgeon with plates, screws, etc. And then you will do rehabilitation on a fixed bone. But with our special needs children, we are doing exactly this. This is a scan of a child with autism. The blue is the area that is damaged or not functioning properly. And we are giving rehabilitation on a damaged brain. We are expecting the children to do stuff their brains will not allow them to do because there are parts of the brain which are not functional. What if we gave life to the brain? You can see the green here. This is activity that's come back. And now we gave rehabilitation on a brain which was active. Would it or not make a difference? So I'm here to tell you today that we can repair this damaged brain and make it functional. So the old thinking was that the nervous system, central nervous system, once it's damaged, it does not regenerate. And the new thinking is we can regenerate it through cellular replacement and repair. So we are going to look at 3 subjects. We are going to look at stem cell therapy, we are going to look at rehabilitation, and then we are going to look at integrative therapies. So let's look at stem cell therapy first. What exactly are stem cells? So stem cell therapy is something which is shifting us from a state of hopelessness to one of hope. The word stem comes from the stem of a tree. And just like the stem of a tree gives rise to branches, leaves, fruits, etc., there are some cells which can become any cell of the body. These cells are called stem cells. A stem cell is a cell which can become anything. It can become a brain, heart, muscle, etc. It's the base cell from which the whole body is formed. How do they work? So the first ability of stem cells is they multiply. If you have a single stem cell, you can make many out of it. Secondly, they convert, like I told you. So if I have a single stem cell, I can make it into a brain cell, a heart cell, a muscle cell, any cell. This ability to convert is the single most important property of stem cells. And this is a real example. This is not a picture from Google. This is my own original research, which we did before we started treating patients. This is what a stem cell looks like. And when we grow it in a laboratory setting, we have shown that we can convert it into these cells. These are nerve cells. So we first showed that a stem cell can become a nerve cell. Not only they become nerve cells, but these nerve cells have connected with each other. So these are living, viable nerve cells which are forming connections. Stem cells also release certain growth factors, and these growth factors help in repair and recovery. They also improve the blood supply to the brain. So where there is less blood supply, when the stem cells go, they attract blood towards it. So these four properties, the ability to multiply, the ability to convert into any cell type, the ability to release positive chemicals, the ability to improve blood supply, this results in a repair. Now, stem cells are of two types. You can take it from the body, from our own body, from the child itself, and put it back in the child. This is called autologous. This is what we use. It can also be donated from somebody else. So we are presently not using donated cells. There are different other types of stem cells. Originally, people were using what is called embryonic stem cells. So when the sperm and the egg come together, it forms an egg. This multiplies, and on 4th or 5th day of life, it's a grape of bundles. These are called embryonic stem cells. And from here, the whole body is formed. So all of us, we started life on the 4th day of conception. All of us were a bundle of stem cells. And from that, our whole body was formed in 9 months in the mother's womb. So if these are removed, these can be used medically, but these are risky. They have ethical issues. They can have complications. So we do not use embryonic stem cells. You can get stem cells from the umbilical cord. The umbilical cord is the cord that connects the mother and baby at birth. And if actually nowadays at birth, they are storing it, in case, your child's umbilical cord has been stored, then we can possibly, use that for treatments. The third type, but we are not using this either. The third type is called adult stem cells. So these are cells from our own body. Most importantly, they are in the bone. And we are using these cells from the bone because they are very easy to get. So we are using adult stem cells because they are simple and safe. And the last is what is called induced pluripotent stem cell. This is a combination. The outside is adult, the inside is embryonic. This is in the research stage. We are not using it. So we work with adult stem cells because first they are safe, they don't form tumors, they don't get rejected, it's easy to obtain through a needle, and there are no ethical issues. How do we inject the stem cells? We inject it into the lower spine because there's a fluid in the lower spine that carries it to the brain. This is called intrathecal. But these can also be given intravenous, they can be given into the muscles, into the arteries, through the nose, directly in the brain. There are different ways of giving it, but we prefer this injection in the back. So stem cell therapy, basically, fundamentally, what are we doing? We are taking good, healthy cells and replacing the damaged cells. That's what we are doing. So if this is a scan of a child with autism, this is the brain that's damaged, you put stem cells and the damage goes away. The scientific base for stem cells is well established. The highest recognition in the field of medicine or science is what is called the Nobel Prize. And the Nobel Prize has been given 3 times for stem cell research in 1990, 2007, and 2012. In fact, what we are using, stem cells in the bone marrow, this got the Nobel Prize in 1990, a long time ago. Now, what is the scientific basis of the work we are doing? So we have a total of 106 scientific papers, 16 on autism, 15 on cerebral palsy. So all our work, whatever results I'm going to show you, they are published in scientific medical journals. This is called peer review. That means somebody outside of me has actually analyzed the data and found it worthy of publication. So in the world of medicine, your work is credible only if it is published in medical journals. And we don't have 1 or 2. We have 106 presentations. Also, this is a medical textbook on autism, recent advances in autism. They introduced a chapter, stem cell therapy in autism, and they asked us to write this. So it's a multi-author book with people from all over the world. But when it came to the chapter on stem cells, they asked us to write it. This is a book on cerebral palsy. And even here, there's a chapter, stem cell therapy for cerebral palsy. And this is a European book, in tech. They asked us to write it. Here's a book on physical disabilities, therapeutic interventions, stem cells and pediatric neurological disabilities, again written by us. Muscular dystrophy. This is a book by Avid Science, Stem Cells and Muscular Dystrophy. This is again written by us. So now in medical textbooks, they are introducing chapters on stem cell therapy for autism, for CP, for muscular dystrophy. And Most often when editors are looking for people, they ask us to write because we have the world's largest experience. In India, the government at the highest level is very supportive of stem cells. Our Prime Minister, Honorable Shri Narendra Modi, when he went to Japan, he took time out to meet Nobel Prize winner Professor Yamanaka. In India too, whenever he gets a chance, he visits stem cell facilities. I'm very honored that in a book which I have written, the Honorable Prime Minister has written an introduction. And it's a unique privilege to have somebody like Honorable Prime Minister Sri Narendra Modi write an introduction for my book. And this is me presenting the book to him. This is the introduction that he wrote. That's his signature, as you can see. So he believes a lot in stem cells. And let's see here, he made a speech in Parliament on stem cells.
मैं जापान गया, तो जापान मेरे कार्यक्रम में मैंने एक कार्यक्रम क्या जोड़ा, मैं वहां एक नोबेल लॉरिएट साइंटिस्ट याकामाहा को मिलने गया। मैं इसलिए किया गया तो उन्होंने स्टेम सेल के अंदर जो रिसर्च की है, मैंने जितना पढ़ा था तो मेरे मन में आया था शायद इनकी एक खोज हमारे काम आ सकती है। हम गए तो वहां गए, उनसे चर्चा की और बेंगलोर के हमारे साइंस इंस्टीट्यूट के साथ आज उस दिशा में हमारा काम हो रहा है कि स्टेम सेल्स के द्वारा हमारे युवा साइंटिस्ट कुछ खोज करें।
So that is the Honorable Prime Minister talking in the Indian Parliament about stem cells. So now let's look at how the treatment is done, how we do the treatment. Basically, it's a three-step process. It's very simple. We take a needle, we put it into the bone above. So this is the hip bone above this is the hip. Above the hip is the pelvic bone. We put a needle into that bone and aspirate and pull out the liquid inside the bone called bone marrow. This is called bone marrow aspiration. We'll see a small video of this. This takes about 15 minutes. The child is sleeping, so there is no pain. We give local anesthetic as well. The bone marrow, we take it to a laboratory. Here we sort of filter it and we remove the stem cells from it. And once we have the stem cells with a very thin needle, we inject it into the lower back side, into the lower back here, because the fluid in the lower back will take it to the brain. So our treatment has got just 2 needle pricks. With one needle we take out, with one needle we put in. So there is no surgery, there's no cutting, there is no stitching whatsoever. Let's see a small video of this. So here you can see the bone marrow is coming out. You can see the needle here. The child is sleeping. We take it to a laboratory. It is run through machines. We have sophisticated machines that count the number of cells. And then with a very thin needle, we inject it into the lower spine. Let's just watch it again. Here you can see the bone marrow coming out through this needle. It's taken to the laboratory. It is run through machines. And with a very thin needle, we inject it into the lower spine. Yeah. So just 2 needle pricks. That's the beauty of this treatment. Just 2 needle pricks. You know, like how you give a needle prick to, check out blood for testing, exactly like that. And see this needle, it is so thin. It is thinner than the needle used for blood collection. So there is no risk at all in this treatment. So just pictures again, that's a bone marrow aspiration, stem cell lab, and we inject it. So let's look at now autism. We know that autism is a neurodevelopmental disorder. It was described in 1943. Normally diagnosed in the first 3 years of life. We refer to it now as a spectrum disorder. Autism spectrum disorder, where it could be mild, moderate, or severe. And boys have it 4 times more than girls. Now the thing is that the incidence of autism is increasing and is going through the roof. In 2004, 1 out of 166 children had it, whereas in 2020 it has gone up to 1 in 54. You know, this is a more than a 3-time increase in the incidence of autism. There's something wrong. There's something completely wrong in the way we are living our lives, that autism is increasing and increasing. This means that there are 70 million people with autism on the planet, 70 million, which is 1% of the world's population. That's not small. 1% of the entire population of the planet has autism. There is something completely wrong in what's going on the world over, and it's not getting the attention it deserves, that autism is increasing and maybe it's preventable. Now, the main symptoms in autism, there's a problem with communication, there's a problem with social interaction, and there's repetitive or restrictive behaviors. So what is new is that today we have a better understanding of autism. We know what's happening in the brain, and now we have a new treatment for it, and that's called stem cell therapy. So now we have these special scans. These are called PET-CT scan, where the blue is the area that is weak, inactive, damaged, not working. And we have in 3,500 children with autism shown that every child had this or a similar kind of damage. The parts of the brain affected are more or less similar in all these children. So for the first time now, we know why our child does not talk, why our child has behavioral issues, why our child can't make eye contact, why our child can't concentrate on something, why there's an attention deficit, because there is parts of the brain that are not functioning appropriately. And now for the first time in medical history, we know the reason. And this work of ours is published in a prestigious journal, the World Journal of Nuclear Medicine, where we actually documented, we have actually published, this is our paper, which parts of the brain are not functioning properly in children with autism. Now, in the management of autism has now become multidisciplinary, so we have to combine all these different rehabilitations and diets and integrative therapies like HBOT, and stem cell therapy is one part. So, you have to understand, stem cell therapy by itself will not completely reverse autism, but stem cell therapy combined with rehabilitation, combined with integrative therapies is what will make the difference. So now let's look at neuro rehab. This is something you're all familiar with, so I'm going to rush through this. There is applied behavioral analysis that is used for autism, that is ABA. Here the belief is that every behavior has something that precedes it and a consequence, and when you modulate that, you can modulate behavior. So then we have different aspects of ABA and psychological counseling. Then there's occupational therapy, which consists of different aspects like activities of daily living, vocational rehab, cognitive behavioral therapy. So occupational therapy consists of many things. This is our occupational therapy room. Then there's sensory integration, which is important because a lot of our kids have sensory issues. This is our SI room at our hospital. Speech therapy has got a very important role to play, and a dedicated speech therapy program can help recovery of speech. Physiotherapy, it was believed that has no role in autism, but we are finding that these kids have physical issues in their coordination, in their gait, in their posture. So we believe that physiotherapy also needs to be given to these kids. So this is our physiotherapy department. Aquatic therapy is very, very beneficial, and you can see all the improvements from reduced hyperactivity, improvement in sleep, etc. So we believe that aquatic therapy has a very important role. Aquatic therapy is not swimming. Aquatic therapy is therapy in water, and it is very, very useful. Then there are various art-based therapies. There's music therapy. Then, of course, there's removal of heavy metals, chelation, TRS detox, etc. Then all of you are using supplements like B6, vitamin C, omega-3, DMG, prebiotics. So all these things you're familiar with, and they're all important. Diet has a very important role to play. The foods that we should eat are ketogenic, gluten and casein-free, curcumin, camel milk, and all have, there's research to show it helps. And the foods to avoid are those with sugars, additives, pesticides, processed food, and difficult to digest starches. A ketogenic diet is very helpful, which basically has enough protein, higher fat, and low carbohydrate. But despite this, are we doing enough? We are not, because our children are still not able to speak. They still have behavioral issues. They are not able to go back to normal education school. And therefore, we need a new treatment. We need a treatment that will reverse the disability completely. And that treatment is stem cell therapy. So these are our results with stem cell therapy. Although we've done more than 3,500 patients, this is data from 700. Which shows that 33% of the patients have a significant improvement. That means they are no more on the autism spectrum. Yes, you heard me right. They are no more on the autism spectrum. We are able to get 1/3 of our children out of the spectrum. 29% have moderate symptoms. Moderate improvements. That means they improve, but they are not off the spectrum. But they are independent. 25% have mild improvement and about 10% don't improve. Now, what we found is that this has an age correlation. So all these kids, they were below 11 years or they were before puberty. So we have found that if you do stem cell before puberty, you get wonderful results. Puberty is the time when the boy becomes a man, he gets hair, sexual organs develop. In girls, it's when menses start. So what we are finding is, do the stem cell before puberty and you'll get the best results. Now, if you do it between 11 and 20, you get moderate or mild results. All these 10% who did not improve, they were all over 20 years. So there is a direct age correlation to the results in stem cell therapy. The older the child, the lesser the results, which is why we do not have time. Very often we think, let us wait, the treatment become more established, we'll do it after a year, after 2 years. The later we do it, the lesser results we are likely to get. So now on what basis are we making a claim that stem cell therapy works? First, there must be what is called statistical significance of our results. Second, there must be objective improvements. So these are various scores. This is called the CGI score, the Indian Scale for Autism, ISA. And we take an average of all the patients we treated before stem cells and after. And then by a mathematical calculation, we have to show it is statistically significant, which we have. And based on this, we can say that stem cells work. This is the different aspects: social relationship, emotional, speech, behavior, sensory, the average before and the average after. And we find all of them are significant. And this is a real proof. I'm showing you 1 or 2 scans, but I've got 3,500 such scans. Yes, you heard me right. 3,500 scans before and after. So above what you see is before. The blue area is the area that is damaged, hypometabolic, and we are seeing this in all our children with autism. 6 months later is the same child below. You can see this damage is almost completely gone. This damage is completely disappeared. This damage is also significantly reduced. So this is objective proof on a general electric PET CT scanner that the damage in the brains of children with autism can be reversed with stem cells. This is proof. You can see the damage before and you can see after 6 months that the damage is gone. All right. So this is another scan. You can see before and you can see afterwards the damage is resolved. You can see the blue above is the damage, and post-treatment the damage is gone. Here again, you can see the damage before and you can see the damage is gone. Well, then some people question that because we do this at 6 months. They say, how do we know after 2-3 years it doesn't regress or come back? So in a few patients, we did it year after year. So here you can see 2012, 2013, and 2014. And we can see that over the years, the improvement continues. It doesn't regress. It only gets better with time. Yeah. So now the world's first scientific paper on stem cell therapy in autism was published from India. It was published by us. That's the paper, autologous bone marrow mononuclear cell therapy, an open label proof of concept study. I'm the first author. So we were the world's first to publish the beneficial results and the safety of stem cells in autism worldwide. The second paper after us, this is our paper. The second paper came from China, the third from Italy. And the fourth and fifth papers are now coming from America. So from the Duke University, America has now started doing this work, but they are way behind us. They're about 10 years behind us. So we have leadership in this. We have 16 total papers, and we've just got a couple of videos. We've got a child from each of the continent, one from the United States, one from UK, Europe, another one from Africa, from Asia, from Australia. But we won't go through all of these. We'll just go through 1 or 2. Let's look at this child from America. This is Ganesh, a 10-year-old child from Kentucky. His father was a cardiologist, doctor's mother's a nurse, so they come from a medical background.
I couldn't get him to engage with me. I couldn't get him to give me eye contact. Over time, he started to lose a lot of vocabulary. Right around 18 months to the age of 2 years, he just slid backwards.
He would flap like that, and he would walk on his tiptoes, look at the wall and be talking to the wall. He had problems with eye contact. He'd never look you straight in the eye. He had problems with his speech. Some research and found out about NeuroGen. And the big question that I had in my own mind was, what is there to lose? And I could not come up with a good answer. And I said, we have to do it.
We started seeing better eye contact, definitely a difference in his engagement with us, with his sibling, his mood. He was so much calmer. Now he's all about taking his own shower. I have to just prompt him to get out, but he'll wash himself and he'll put his clothes on. It's all the PET scan images. I can't tell you the word, we were just so excited and thrilled. The areas that were hypoactive or non-active were warm. There was activity there. Ganesh has gone from the 3rd grade, 4th month reading level to a 7th grade, 1st month reading level in 5 months.
So here's a child who could not speak, who was in a special school, whose parents are both medicos. The father is a cardiologist, specialist surgeon, the mother is a nurse. And after stem cells, not only is this child shifted to a normal school, not only is this child talking normally, in fact, now he's talking in 5 languages, but he's topping his class, he's getting A+ grades. That's the magic and miracle of stem cells. This is what it can transform a completely dependent child into. So there are a couple of other videos. I think we'll, here's this, now all of you have maybe one child and you know how difficult it is to handle. What would it be like for a mother if she had 3 kids with autism? Let's see the story of one such parent.
We went to different doctors, we went to different hospitals, and when I brought it up, they were like, oh, no, don't worry, it's because they are boys, they are triplets, they were premature. I would be walking out and I'm like, bye. And no child is crying, no child is waving back bye. And by then, for sure, I knew that they should be doing that. Children had this behavior of disappearing. In fact, Eric disappeared 3 times in the middle of the night. The biting, the spitting, the scratching. How are we going to stop this behavior? We went to see the neurologist, and in 5 minutes, he said, these children are autistic.
As parents, it was very traumatizing. First of all, we didn't understand what autistic means.
So I decided to really get to read a lot about autism. I remember the first time I read about stem cell. I was like, wow, this is really good.
We had a lot of questions which we asked, and we got very clear answers from Dr. Sharma.
The day of the stem cell itself came. Actually, I was a bit anxious, of course, but really I didn't have fear. A bit of apprehension, anxiety, of course, as a mother, but I knew they're in good hands.
We put a needle in this pelvic bone and then we take out the bone marrow, which is the fluid inside the bone. The pure stem cells, once they are ready, a thin needle is inserted into the lower back. We inject the stem cells into the cerebrospinal fluid. It flows all the way up to the brain.
Things that would have taken probably years to be accomplished in my sons, in like 8 months' time, we've really been able to come very far.
They used to defecate on their clothes, but now they can use the toilet. We've seen a lot of improvement in terms of spitting. The tantrums have reduced. Sleeping used to be a problem before, but at the moment, he's taken to his bed, takes a few minutes, and he's asleep.
See my son cycle. you try to make them understand what it is to pedo, and it couldn't. But after stem cell, when we arrived in Kenya the following day, and we went out, and these guys would cycle. I'm going to send you to buy tomato paste, okay? I'm going to send you to buy what? In the shop. Where is the shop?
It's here.
Okay. So I'm going to give you
Money.
for what?
Buy tomato lollipop. I'm going to wear my shoes. That's
Parents ask me, so do you really think stem cell works? And I'm like, I can see changes, I can touch, I can feel, I can smell. Of course, for me, stem cell works. I'll do it until my children get well.
So that's a mother with 3 kids, triplets, who were extremely hyperactive. None of them were going to a normal school, and now they're going to normal schools. They've completely come out of the autism spectrum. So this is an older film, but just last week our team was in Nairobi, and they've seen these kids. They're just doing amazingly well. And one last, so we saw a child from America. This is a child from Africa. Let's look at a patient from Asia, from India. So this child who had autism, he was very hyperactive, poor understanding, poor setting, poor.
Shantanu was my first child, so I was very excited about how he would be. But when I came to know that my child has a problem, it shocked me, and I wondered, why did this happen only to me?
Shantanu's behavior was very different from that of other normal children. For example, normal children walk on their feet, but Shantanu walked on his toes.
It has been 2 months since Shantanu's stem cell therapy. There have been many changes and many improvements. His hyperactivity has reduced drastically, and his attention span has improved a lot. He sits patiently in one place. He has started coordinating with his sister very well. He plays with her very affectionately. We are glad we took the decision to give him stem cell therapy. It has been 6 months since the stem cell therapy. Shantanu has shown a lot of improvements. His hyperactivity is almost as good as non-existent. His handwriting has become much better. His eye contact has also become better. I have never seen Shantanu dancing, but now he takes a keen interest in dancing. He also likes to listen to music. He can now fold clothes. Earlier he was not able to fold even a handkerchief, but now he can easily fold blankets. He helps me in cutting vegetable and in cooking too. Goes to the market store for purchases. He passed his 10th
So
grade.
he passed his school. He's gone to college now.
There have been improvements in many other aspects as well. For example, this emotional quotient has also increased. Now he hugs us very affectionately, calls me mother. Now he takes tuitions of other special
This
kids.
child who could not speak is taking tuition of deaf children. Can you imagine? A child who could not speak once is now taking tuitions. He's making a living. He's studying in college and he's earning by taking tuitions for deaf children. So that's the magic of stem cells. I think we'll skip the other videos. We'll just look at cerebral palsy now. Basically, in cerebral palsy, there is damage to the brain, but you see more signs in the body. There is tightness in the body, there is weakness in the body. There are different types of cerebral palsy, either one side or only the legs or the whole body can be. So there are different medical classifications. As you can see, the brain scans, the damage is more severe. If you remember in autism, there was a lighter blue damage. Here it is almost black. The damage is more severe. There are some treatments that can help for the spasticity and convulsions. There are some surgical procedures, orthopedic and neuro, which can be done. But the children still remain, with significant disability. All these treatments don't help them to get off the wheelchairs. They don't let them walk or use their limbs, but stem cell therapy does. So these are our results. 91% of our patients showed improvement. 20% had a significant, that means they became normal. 41% moderate, 30% mild, 9% did not improve. And here is a scan. You can see before the brain, you can see the damage, and after stem cell, that blue is gone. The damage is completely gone. Here again, you can see above is the damage before, and below is after the stem cells, much reduced. Our work is published in this paper, Clinical Study of Bone Marrow Mononuclear Cells, A New Frontier. It wasn't the world's first. In autism, it was the world's first. In CP, somebody had published before us. We have several other papers on this as well. Let's see, this child from Nairobi, Kenya was totally wheelchair bound. And you can see the improvements, totally wheelchair bound, could not use his hands and legs at all. And now you can see he's able to sit by himself, which was not possible. He's able to remove his shirt and wear a shirt. He can pack a bag. Earlier, he could not use his hands at all. Now he's using his hands, charging a mobile, taking a water from a fridge, opening it, drinking. Earlier, neither could he stand nor could he use his hands. And now you can see from a wheelchair existence, he's now able to walk almost independently. So we freed this child from the wheelchair. This child who could not even stand is now walking independently. This child who could not use his hands is able to use his hands to open the fridge, take out water, charge mobile, and so many other things. That again is the magic and miracle of stem cells. Then intellectual disability. Earlier this was called mental retardation. Now we don't use that word. We call it intellectual disability. And there are various problems over there with cognitive abilities. And here you can see the damage. It is a little different from autism. It's more wider, but it is less severe. And these are our results. We have an 84% success rate. So 20% have a significant improvement, 25 moderate, 39 mild, 13% do not improve. So it's a 84% success rate. And the functions that improve are, cognition, memory, problem solving, relationships, social inhibition, toilet training. So these are all the things that improve. And here again, the world's first paper. Yes, the world's first paper on stem cell therapy for intellectual disability was written by us. An open label proof of concept study, bone marrow mononuclear cells and ID. This was written by us. So again, it's a matter of honor for us. And we don't say us, we say India. The world's first scientific paper on stem cells and autism was published from India. The world's first paper on stem cell therapy for intellectual disability was published from India. So that is what is important. And here is a scan. This is a scan of a child with ID. The blue is the damage, and post-scan, you can see the damage is significantly resolved. We have 5 papers on this, and we just, now finally, the last condition we look at is muscular dystrophy. Here, the muscles are damaged. You can see the muscles, they become weaker. Here, you can see at 5 years, the gray is the muscle. It's nice and gray, and white is fat. And by 16 years, there's almost no muscle. It's only fat. Here you can see the comparison between 5 years and 21 years. Huge difference. Here, this is all solid muscle. And here you can see, the muscle is gone and it's all white. But with stem cell, we can help. We've treated now a whole lot of patients. 4.5. Now here Percentage of children who become close to normal is much smaller, 4.5, 35 have a moderate, 20% have mild, and 14% are stable. Now, what you have to remember is that if he had not done stem cells, all these children of Duchenne muscular dystrophy would have died. Yes, you heard me correctly. In Duchenne muscular dystrophy, there is 100% mortality by the time of 25. Not only are we preventing death, but we are actually causing symptomatic improvement in these kids. So this is what is called a comparative study, where we compare patients who took stem cells, and the green is that they stabilize, versus the patients who did not take stem cells, who continue to deteriorate and very often died. So big difference between treated patients and untreated patients. And here's a scan before and after. Before, you can see the white is the muscle, is the fat. There's no muscle here. And after stem cell, muscle has come back. And this is just a EMG wave pattern. You can see how weak it is before, and after stem cell, it is improved. And we have several papers on stem cell therapy in muscular dystrophy. Here's a child from America, from California, who had Duchenne muscular dystrophy. He could barely crawl when he came to us. He had not stood for 2 years before coming to us. So before, he could barely crawl. And afterwards, you can see now he's able to stand. He had not stood for 2 years before coming up. So the first time he stood in 2 years. Not only is he standing, you can see that he started walking a little as well. Now he's walking with support. And now you can see he's walking without support indoors. And here you can see him walking outdoors without support. He went back to America. His success story was heard of by President of America, Barack Obama, and he was invited to the White House to discuss his improvements. There you can see he's invited to meet President Obama in the White House because he heard about the wonderful improvements that this child had. So we treat many other conditions, but I've restricted my talk to just autism, cerebral palsy, and muscular dystrophy. Now, a question in all your minds will be, how safe is this treatment? So the first thing is it's extremely safe. We have treated more than 10,000 patients overall, 3,500 of autism, another 3,000 cerebral palsy, another 3,000 muscular dystrophy, etc. So we've had no major adverse events or complications. No child has deteriorated or become worse. So there you have my guarantee of safety, that nothing will possibly go wrong. Now, there are some minor adverse events. So 3% of the kids who already have epilepsy, the epilepsy can transiently increase in the first 2 to 3 months. 10% of kids get a headache. It's called a spinal headache. It lasts for 2 days, but it is when you're in the hospital. It doesn't come when you go back. Some kids have a nausea, vomiting, pain, etc. So it's a very safe treatment. The minor adverse events are manageable. There's no major adverse event. Now we look at the last aspect of my talk, which is integrative therapy. So this is a new concept where we are using primarily therapies that improve the oxygen and blood supply to the brain. So there are different kinds of treatments. These are all the machines. So basically, this is treatment with various machines, and these are all. So there is no operation, surgery, no such invasive treatment in that. So the first thing that we use is something called hyperbaric oxygen therapy. Now, a lot of people ask us, what is the difference between doing only stem cells and rehab and doing stem cells, rehab, and integrative? So the answer to that is like this. See, stem cells are like seeds. So suppose you have the same seed, you have 2 sets. One set of seeds you put near a river bank where the soil is fertile, and the other set of similar seeds, you put it in a desert soil. Which one will grow more? The one near the river, right? So the seed is important, but the soil is also important. What you put into is also important. Therefore, all these treatments that I'm going to talk to you about improve the soil. They improve the brain functioning, so that the stem cells, when they go, they have an overall better result. So the first treatment is hyperbaric oxygen. This is a chamber. You can see the chamber is there. The door opens. There is a bed, a stretcher-like bed, which is very comfortable. You lie down inside, you go, it is closed, and oxygen is given under high pressure. So what is the usefulness of that? The whole idea is to improve the oxygenation of all the tissue, including the brain. So this is how it is. The father or the mother goes in with the child and they're lying comfortably. There's a TV screen. The child can watch the TV programs, or you can just shut the light and, go to sleep. So now, how does hyperbaric oxygen work? See, normally, like you and I now, we are breathing normal air at 1 atmosphere pressure. So when you breathe air at 1 atmosphere pressure, the air goes through our lungs into our blood, and then it gets carried all over the body. But it gets carried only in the red blood cells. So our body has got red blood cells, white blood cells, and liquid. So only the red blood cells, the hemoglobin, you heard the word hemoglobin. So the hemoglobin in the red blood cells carries the oxygen everywhere at 1 atmosphere pressure. But the moment you give it at 1.5 or 2 atmosphere pressure, the oxygen enters the liquid of the blood. This is called plasma. So before, only the red blood cell takes, but after this, the plasma, the liquid, starts, carrying the oxygen. And with this, we have found amazing improvements, which compound the improvements of the stem cells. So stem cells combined with that works. Hyperbaric oxygen also improves the blood supply through a process called angiogenesis. And as the oxygen improves the brain and the stem cell, they work beautifully together. It has several other effects, including an antidepressant effect. It promotes neuroplasticity. So all of these things are also helpful. And this is just technical as to what it does in the brain. The second therapy we use is something called ozone therapy. So what is ozone? So oxygen is O2. Oxygen has got 2 molecules of that's called O2. Ozone is O3. So there is an extra oxygen molecule. It's a supercharged, superactive oxygen. That's what ozone is. So we call it an activated oxygen. And what it does is, first thing, it is a very strong anti-infective this thing, in the sense it kills the viruses, bacteria, fungal infection. It reduces inflammation and swelling, reduces blood clots. It has an antioxidant effect. And all of this modulates the immune system, and it has, very good actions: antioxidant, anti-inflammatory, anticoagulant, and germicide. So there are different ways in which you can give. You can just have to sit in a chamber and ozone is given. You can breathe it. It can be given through your ears. It can be given through the rectum for gut cleansing, etc. So this is what it does. It improves the gut health, because we know in children with autism, there is a lot of gut issues. So the ozone given through the rectum helps in resolving these issues as well. So that's the sort of list of all the things that ozone therapy does. We've already looked at all of these, including modulating the immunity, reducing the inflammation, and getting rid of all the infections. Then we have acupressure, which is pressure applied to the body at specific points, which includes a relaxation, release muscle tension, improves blood circulation, and has an overall very healing effect, because the sole of the foot has got points which correspond to different parts of the body. So when you give pressure there, it relaxes the whole body. So there are all these, combination of acupressure, deep tissue mobilization. This improves the blood supply, reduces pain, reduces sensory arousal. It's very relaxing. And basically, there's a release of what we call happy hormones, which is serotonin, dopamine, etc. Then we, depending on, we do blood tests, and some of these kids have deficiency of, some of the B complex vitamins, some are deficiency of vitamin D, vitamin C. So we replenish all this. We replenish what is less. If the levels are normal, then we may not do this. We replenish what is less. And these are all micronutrients. All of them are essential. All the above, the magnesium, calcium, zinc, selenium, all the vitamins, B complex, C, A, D are all important. Omega-3, glutathione, NSAID. So these are all supplements which may be given. And that's, so as you can see that the improvements that happen, they happen over a period of time. You can't have improvements happening suddenly. So the integrative therapies, you start seeing the improvements over a period of time. So, like I said, what we have noticed is that there is decreased hyperactivity, there's improved behavior, improved speech, there's reduced repetitive behavior, speech, sleep, all this improves, learning improves, cognition is better, eye contact improves. They start showing attachment to family members, better command following, so on and so forth. So these are different improvements that we have seen them being reported. So this is the institute where we work, the NeuroGen Brain and Spine Institute in Navi Mumbai. This is an institute dedicated for the work in stem cells and neurological disorders. We've treated more than 10,000 patients from 70 plus countries, from all the 6 continents of the planet. So from all over the world, people are coming to India for therapy. This is our core team, apart from myself, Dr. Nandini and Dr. Prerna, the stem cell experts, Dr. Jacob is the rehabilitation expert, and Dr. Himangi Sane. She got a really amazing story. She was a doctor in New York. She got her MD from New York. She was working there when she developed a disease called ALS, or motor neuron disease. She went to the best doctors in America, to John Hopkins, everywhere else, and was told just one thing, that she had a few months to live, and she would not survive this. But she didn't give up. She came to India from America, and I treated her. And that was 10 years ago. Not only is she very much alive, but she's now heading our research department, and we are doing some wonderful work together. So don't go by what others say. Believe in yourself. So we believe in quality control. So we have a lot of accreditations like good laboratory practice, good manufacturing practice, ISO certificate, etc. Here we are certified by the European Medical Association, EMA, for best medical practice. This means just our standards meet European standards. We've written 16 books. You can see all those books, and they're all distributed free of cost. You can go to our website and download all of them. We never charge for any of our books. And I received this Bharat Gaurav Award for distinguished services to the country. This is an award that's given in the British Parliament. So it's an honor to receive it there. And I got this other award called the Superhero Autism Award 2021 from the Synergies Global Academia. The Rose of Paracelsus Award. This is a prestigious award given for original research. It comes from Oxford, UK. And it's a real honor to get this award because it acknowledges our research. And this is another award from the European Society for Quality Research for best practices. We got this in 2018. Again, this award is given for exemplary research, original research. We were nominated the best stem cell therapy center, not nominated, we were given the award for the best stem cell therapy center in India at the National Healthcare Awards in 2016 as well as in 2018. So to help you decide, you could visit our website, which is NeuroGen BSI. BSI stands for Brain and Spine Institute.com. Our email is contact@neurogenbsi.com. The response time to your email is less than 30 minutes. So when you send us an email, we will reply to you in 30 minutes. And it's a doctor who replies, not some administrative person. You can WhatsApp chat, audio, video call with us. You could send us a call at 9920-200-400. Or we could set up a Skype or a WhatsApp video interview. Once you decide to take the treatment, you are appointed a specific coordinator who will become your one point of source for everything and will assist you through the whole process till you come here. You need to arrive on a Sunday only. Okay, you will come Saturday evening, Monday morning, but you have to come on Sunday. Monday, all the evaluations, all the scans, all the detailed checking is done. Tuesday is the stem cells. Wednesday to Saturday is rehab. And on Saturday, you go home if you do a 1 week program, right? We have an option now of a 2 week program with integrated therapies. Then you stay for 15 days. So adult stem cells may be considered safe and effective. Notice I've put safe before effective. Safe and effective treatment option for autism, cerebral palsy, and many other pediatric and adult conditions which cause paralysis. So that is my conclusion. And
scientists believe these tiny cells may have the potential to help us understand and possibly cure some of our most devastating diseases and conditions, to regenerate the severed spinal cord and lift someone from a wheelchair, to spur insulin production and spare a child from a lifetime of needles, to treat Parkinson's, cancer, heart disease, and others that affect millions of Americans and the people who love them. Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research. There's no finish line in the work of science. The race is always with us. The urgent work of giving substance to hope and answering those many bedside prayers, of seeking a day when words like terminal and incurable are potentially retired from our vocabulary.
So I'd like to end with that, when words like terminal and incurable are retired from our vocabulary. So the world's two biggest democracies are India and the United States. You heard the Prime Minister of India talk in Parliament about stem cells. And you heard President Obama, past President of America, talk about stem cells. So obviously, this is not just any other treatment. When presidents and prime ministers talk about something, it must have a certain importance. But for us, all we are concerned about is how will this help our children? So with that, I'd like to end the webinar. I'd like to thank you for your attention. I'd like to thank you for being with us. Now, if there are any questions, I'll be happy to take them. You can actually type them in. So I'm seeing the questions. I can't see any questions. So Nita Gajaria says good afternoon. Avinath Salsebal says good afternoon as well. Rahuna Muhammad says good afternoon. Samrang Virachang says good afternoon. I can't see any questions. Deliwala Liange says good afternoon as well. All right. Now let me see. Samrang says thank you for adding the Autistic Thai Foundation. We are working towards the betterment of the quality of PWA. Okay, so the first question, Isara Vijay Vikrama says, good afternoon, sir. My child, 20 years boy with autism. Is it recommended to follow? Yes, now 20 years is a little older. And as we saw that, with age, the results keep coming down. But the oldest child we've treated is 38 years old from England, and he showed improvements. So it's never too late. Yes, the improvements we get at 5 years is better than the improvements we get at 10 years. The improvement we get at 10 years will be better than that at 20 years. So we cannot expect him to become totally normal, but he will show improvement. But I suggest we treat him, because the longer we wait, the less will be the results. So to Isara, we can treat your 20-year-old boy. Rahuma says, may I know from which hospital I can get stem cell therapy? So the name of our hospital is the NeuroGen Brain and Spine Institute. We will be sending you information about our hospital. It's located in Navi Mumbai, which is just adjacent to the city of Mumbai in India. And this is a dedicated hospital for stem cell therapy. Champa says, I also wondered which hospital can get stem cell therapy and the cost of this. So we will have all this information sent to you. The hospital, I repeat, is the NeuroGen Brain and Spine Institute. And normally we don't discuss costs on a webinar, but we'll have somebody from our hospital speak with you, and we will give you all the costing. Anita says, thank you for such an informative seminar. Thank you so much, Nita. Thank you for arranging this. Sudha, to everyone. So does it institute do diagnosis? Well, yes, of course we do diagnosis. We have psychologists, occupational therapists, physicians, everybody. So we will do a pediatrician and everything else. We do the clinical as well as investigative diagnosis as well. Champa says, thank you. Can you tell me how much is the cost for therapy? So you will be because the cost of therapy depends on the kind of accommodation you take. We have different types of accommodation. Also depends on whether you stay for 1 week or 2 weeks. So somebody from our hospital will get in touch with you and we will do a detailed costing with you. Ahmad Rashid says, my brother is 11 years old and he has Angelman syndrome and epilepsy. Is stem cell recommended for him? So Ahmad, we have treated, first the age is good, 11 years. At this year age, we get good results. We have treated many patients of Angelman syndrome. They do well also. But we will have to have some more details about the child. We'll have to, so if you can communicate with us. All of you who have attended this webinar, you are entitled to a free virtual consultation with me, in which we can have we can coordinate and, I'll give you about half an hour time where we can understand all the problems with your child. So please request for a virtual consult with me, which is given without any cost. Satvi God says, hi, these are benefits, great to know all that. Can you please tell us the risks involved in the therapy? So I said that in 10,000 patients, not a single patient has become worse, deteriorated, become bad. So there are no risks, no major risks. There are some small risks, like children who have epilepsy. The epilepsy can increase in the first 2-3 months. So these, 10% of the kids have a little headache. It lasts for 1-2 days, but this is when you're in the hospital, never at home. But apart from these minor things, there are no major side effects. Atifa Ali says, my child gets sudden anger and he cannot control. I do things like throwing things. And what can I do to control him? So there are some medications that help in controlling this sudden anger and aggression. However, once we do stem cell therapy, this will disappear. We find that all these behavioral issues, this anger and all completely disappears. Can you give me a contact method? We will give you a number and a name. So there's Miss Jigyasa is going to be looking after you, and her number will be shared after this. You can directly contact her. Ravuna says, thank you so much. All right. Thank you. Any more questions? I'll be happy to answer them. So Sudha says, do you diagnose for child developmental delay? Yes, we diagnose. We do the diagnosis. We do the treatment as well, Sudha. So after diagnosis, we do the treatment. Samsha Al-Khayali says, can stem cell cure genetic disease? Yes, it can. Duchenne muscular dystrophy is a genetic disorder. We've treated that. But we need to know which genetic disease it is. So there are many genetic diseases which can be treated with stem cells. Satvi says, hi doctor, do you attend all the therapy big day when the stem cell therapy takes place? Yes, I'm there. I definitely attend when the therapy takes place. Mariam says, how much will it cost? So like I said, we normally don't discuss commercial things costing on the webinar, but you will be contacted by one of our people who will do the detailed costing with you. Okay, we got your email, Champa. We will communicate with you. Mariam again says the cost. So we'll let you know. You'll get a call from us or a WhatsApp message and we'll send you the detailed costing. Tifia says, is stem cell therapy helpful for behavior problems like ADHD? Definitely yes. The ADHD, we get the best results because ADHD is almost like a milder form of autism. So the results are wonderful. If there are no more questions, we will end this webinar. Ms. Jigyasa will contact you for a one-on-one virtual consultation with me subsequently. No, there are, Mariam asked, are there any side effects? So, like I said in my lecture, there are no major side effects. No child deteriorates or becomes worse. There are a few minor side effects that can occur, like a little headache, a pain, or a vomiting. It occurs in some children. And those children who have epilepsy, they can be a little increased. But otherwise, there are no major side effects. Okay, if there are no more questions, we'll. So Sudha says, how do I know whether my child is autistic or any other disorder? So we'll do the diagnosis. When you come to us, we do a clinical diagnosis and we do brain imaging. We do scans and tests. And we tell you exactly, is your child autistic? Does your child have a developmental delay? What are the problems? So we'll give you a diagnosis. All right. So if there are no further questions, we will end this webinar and we will be subsequently, not right away, we might be able to do one-on-one consults with those of you who've attended. And I want to thank you for your attention. I look forward to all of you coming here. Welcome to India and welcome to NeuroGen. Till then, stay safe. And once you come to us, the children become our responsibility. We will make them okay. God bless. Thank you.